Hello again, everyone. So I realized while I was editing my last travel video that it was getting just a little bit long, so I decided to split it up into two parts. In this part, we're going to be talking about tips for traveling, not only for ostomates, but also for people with like other bowel problems, bowel issues, bowel diseases that may require infusion therapy. As I mentioned in the last video, I have a PICC line, and traveling with a PICC line is usually not too big of a deal, but typically if you have a PICC line, the reason is that you need infusions daily or a few times a week. So that's my case, and traveling with infusions or traveling with the supplies that you need for infusions can sometimes be a little bit hectic. So we're going to go over some tips that I have for you all pertaining to traveling with chronic diseases, bowel disorders, and with PICC lines. Well, this is my PICC line. It is on my right arm, but yeah, this is what it looks like. I have a double lumen power port PICC line, and it is invaluable for getting infusions. Otherwise, they would have to obviously use veins, and my veins are notorious in my local hospital for being very difficult to get. So they always collapse, and there's always an issue, and it's usually due to my chronic dehydration. But yeah, I just wanted to give you guys an idea of what my PICC line looks like, and let me know if this is something that you also have for your disease. So first off, going back to TSA, your fluids, they will not be allowed in your carry-on bag. Unfortunately, they're quite a bit above the normal level that they would allow for you to take in flight in the cabin. So always put them in your checked bag. For this past trip that I took about 3 liters of fluids with me because that's what I needed for the few days that I was gone. This is what they look like. They're quite large. They're quite fluid filled. Obviously, you cannot take them in your carry-on luggage, but you can absolutely take them in your checked bags. As far as I know, I've never had an issue. I think once or twice they've had to do like one of their little checks that they have for your checked bags, and they'll leave like a note telling you, we've checked this bag, it had suspicious materials in it. So if they check it, don't be alarmed, but this is fine to take in your checked luggage. Now this is what I like to call ratchet infusions. I make this joke with my family and friends when I'm going away and I don't have my IV pole on hand. So I get a normal hanger, any kind of hanger will do. Sometimes I bring one in my suitcase if I'm like not sure if the hotel is gonna have hangers, but this time around they did have hangers, so I didn't have to worry about it too much. But this is what I do. So I got a hanger, I got my IV bag, and then I very simply go through the top. You'll see it always has like a little hole at the top. You go through the top and boom, you've got yourself a portable IV pole. Now, the thing that can be a little bit challenging about this is that you obviously need to hang it somewhere. So it can't be, you can't like carry it around like this, like a really cute purse, because it has to be like above you. As long as the pole or the bag is significantly higher than my head, I have pretty quick infusions because I don't have an IV pump. It's something that typically they like to have a nurse look over if you have one, and my nurse only comes once a week and I do infusions every other day. So I have this gravity system so that I don't need to have a nurse constantly on call. So in order to address the question of how do I hang this little hanger contraption once I get to my hotel, this is a really good idea that I came up with on I think my last trip out of my state area. Command hooks. So in the past I've just hung them on like anything I could find, lamps, whatever, but they weren't very high above my head and my infusions as a result would be very slow, and usually when you're traveling you're out and about all day and you don't really feel like having like a 4-hour long infusion if you're having a gravity pull system and you don't have a pump. So I get these command hooks. It doesn't really matter which shape or style you get. It does matter the weight limit. I try to get one that's between like 2 and 5 pounds, depending on how much infusion that I need to use that day. It's just better to have ones that are sturdier. Just get a command hook that will hold at least like 2 to 5 pounds. And because I know my infusions are heavy, I'm not sure about everyone else's, but you just stick it to the wall, and what I like about them is obviously they are removable. So when you're done with your stay, you can just take this off the wall, be done with it, throw it out. It's like you were never there. But having this is really nice. The one drawback is that you're obviously kind of tethered to the wall when you do this. So you might need to either unplug or, you know, not move around as much, depending on how active you are in your hotel room that day. But if you're just sitting there for like 2 hours or an hour to get your infusion done, it's definitely worth it to not have to bring a big old IV pole that will probably be difficult to get through the airport. If you're driving somewhere, then bring your IV pole. It can't hurt. Usually hotels are fine with them, but I would definitely recommend if you're flying, don't bring the IV pole. Just do what I did with my ratchet bag hanging system, which again is just funny to me because like this looks so weird, but it really works. So yeah, as you can see, this fits very well on here. It'll hold it up and you don't have to stress about not having brought your IV pole with you. I want to talk a little bit about staying in a hotel room with an ostomy. It's not that different from staying in a hotel room pre-ostomy, but there are some things that can maybe make your stay a little bit more comfortable. And this isn't just for people with ostomies. This is also for people with PICC lines. This is also for people with any kind of bowel disorders, really. Because staying in a hotel room, out of your normal space, new bathroom, new setup, it can be a little bit much. And I would recommend, first thing, take, you know, a good minute to like look around the room, make sure you have a good bathroom that you like, make sure that you have space for all of your supplies. Bring all of your supplies with you and try to also bring some extra supplies like what I mentioned with bringing a portable like ostomy bag that has all of the things you need to make quick dressing changes for any wounds you may have or your ostomy, just so that Freya. No. Try to make sure that you have everything that you need in your carry-on to make like quick dressing or ostomy changes. I'm going to show you some of the other things that I like to bring in my travel bag for my trips with an ostomy. This is the inside. It's got adhesive remover spray. It's obviously got bags. It has some wound dressing since I still have an open wound. It has things like Aquacel and Tegaderm in here. I have barrier strips that help extend the perimeter of my wafer just to give me some extra protection. And one of the other little simple things I want to recommend to you guys when you're traveling is to have thick, very absorbative towels with you, disposable. These guys are nice. I would kind of relate them to like very thick tissues. They're great to have at the airport or at a hotel. Sometimes the airport will have, I would say thinner paper for toilet paper. Not the best if you're trying to like clean up your ostomy or you've had a leak and you need like a lot of help or maybe you're dumping that day and you want to have something to press against the stoma so that you can keep it dry so you can put a bag on. These guys are awesome. They're basically just thick napkins. I went around Wegmans and was like, okay, what's the thickest napkin they have? And this was it. So they are very cool. They help you feel like, okay, even if I leak on this plane or in this airport or at this hotel, I have access to paper towel like absorbative papers so that I can feel some level of comfort knowing that if I leak, it's not the end of the world. And as a side note, please let me know if you want me to do any like PICC wrapping tutorials or PICC line maintenance tutorials. I've had my PICC line since last April and it's in very good health. We're interested in getting a port for me since it seems like high hydration therapy is something that I might need for a very long time. But until then, I have a PICC line. It's really helpful for me. I'm sure some of you out there have them, especially if you're like a colorectal patient because you had colorectal cancer or something along those lines. And I know some Crohn's patients also get infusion therapy, so you guys may have PICC lines. So just let me know if you want some tips and feedback on how I take care of my PICC line and some of the things I've done to keep it safe, protected, and keep me showered because one of my first like concerns with getting a PICC line was you can't get it wet. I'm like, well then how am I gonna shower? I'm kind of like into showering. I like to be clean. So I can talk a little bit about how I dress my PICC line. I know it can be tough if you're like trying to get in a pool or a bath or something. I wouldn't necessarily recommend that, but taking a shower is certainly more than possible with a PICC line. So I can go into that in a further detail in a different video. Well, that is it for today's video. Please, again, let me know in the comments how your travels with ostomies, PICC lines, etc. have gone for you. I'm very curious. I love hearing your stories and getting to know you guys, so please feel free to leave comments. And let me know if there's anything else that you'd like for me to mention in future videos. I'm definitely open to any ideas. But this most recent trip really got my brain going about, okay, how can I help people who may also have some slight travel anxiety due to medical disorders? So I appreciate you guys watching, and I will see you in my next video. Bye!